Well, hey, I'm here with my friend Dr. Jeff Barke. Dr. Barke, it's just a pleasure to have you here. As always, you've been a great friend to me and to all the people that tune in to Our Watch with Tim Thompson and even the congregation that I'm a pastor of, 412 Church in Marietta. They just love you, and they love the candor that you come with. And there's something very hopeful for us when we see a doctor who's willing to put his reputation on the line, to put his, to put everything on the line to stand for freedom, and that's
right.
That's what you've done.
Tim, great to be with you. I appreciate you having me back.
Yeah, it's always important for us to get from the medical professionals what's really going on, and the reason I asked you on today is, with the Delta that's going around, there's a lot of fear. A lot of people are afraid.
Yes.
And there are people getting sick. We even have some people that I know that are close to my family that they're in the hospital right now. They're on a ventilator. This is scary stuff.
Yes, it is.
But it doesn't have to get to that.
No.
And that's what you're here to talk about. So why does it not have to get to that? And how do we make sure it doesn't get to that?
It's a great question, Tim. And most importantly, I don't want people to live in fear. They need to be prepared but not scared. Hey, I just made that up.
Poet,
right?
You didn't know it.
Yep, prepared and not scared. Here's the thing. We're really good at treating COVID-19, but the key is you have to treat this illness early in the mildest stages, and then we're very good. It's absolutely wrong to stay at home while you're ill, waiting to get so sick that you need to end up in the emergency department. That is the wrong approach. We don't do that with any other disease. Imagine telling a woman who's newly diagnosed with breast cancer, sorry about that, you just stay at home. If it should get worse and spread, then you give me a call. We don't do that with any other disease, and we shouldn't do that with COVID.
Right.
You've heard about some of these repurposed medications. For some reason, they're controversial, despite the medical evidence showing that they are effective. Multi-drug regimens, when treated early, are very effective. So here's the key. Be prepared, not scared. And how do you be prepared? Before you're ill, find a doctor or access to somebody that can provide you with care and treatment. You can call your own doctor to start with. Maybe you get lucky and that doctor knows what they're doing and they're willing to prescribe to you to have medication at home in case you get sick. So that's step one. If you can't find a doctor, if it's not your own doctor, ask around friends and family, maybe somebody who's had COVID that was able to get treatment. Call your local urgent care center. Many of these urgent care centers locally to this area will treat COVID. You might even make an appointment to go in before you need help. Just a routine office visit to talk to the doctor and say, I want to be prepared, and would you please prescribe for me the few medications that we know work well so you have something at home in case you get ill, because once you're ill, it's a very scary process to start scrambling, to try to get help, to go online and try to get help. It's scary, and often that kind of treatment is very much delayed. As you know, I'm a member of America's Frontline Doctors. We've got a site for telemedicine, but right now we're getting about 4,000 calls a day from people around the country, and so that care is often delayed several days, even a week. There's an online site called myfreedoctor.com, myfreedoctor.com. That's another site that does telemedicine. You can go on the FLCCC, FL then 3Cs.com, and there's a listing there of doctors in your area that understand how to treat COVID and are willing to do so. So please be prepared, not scared, and make sure that you're ready. Just like we were supposed to be prepared for the big earthquake. We live in Southern California, right, or for whatever other natural disaster. Have enough food, have enough water, have a game plan. The same thing. We all know people that have gotten COVID, and I know too many people that don't reach out for help until they are very, very ill and they've had it for 10 days and they now don't know what to do, and at that point, it's a much more difficult disease to treat. Right. Treat early, be prepared, not scared, and then you can no longer need to live your life in fear.
Amen. So, a friend of mine, somebody that's near and dear to my wife and I, she got sick. She got to the point where she was saying, I'm having trouble breathing. She goes to the hospital. Once she gets there, they say, you're not severe enough, go home. So she goes home, a couple days go by, she's getting worse and worse. She goes back to the hospital. I'm still having trouble breathing. They said, you're not severe enough, go home. She goes home, comes back again to the hospital, and they say, oh, within 30 minutes of her going back the third time, they say, oh, we need to put you into an induced coma and put you on a ventilator.
It's crazy.
And those other times she's at the hospital saying, I need help. Never once did they prescribe her anything. They didn't tell her, hey, start this type of treatment so that way you don't get severe enough. And so this is frustrating on many levels. What do you suggest to a patient who gets sick with this and they go and somebody says, you're not severe enough?
I'll tell you, for me, Tim, it's almost embarrassing when I hear stories like that. There's a group of doctors around the country that know how to treat this and are doing so effectively. I have personally treated hundreds of patients with COVID-19 very, very successfully. So again, don't wait until you're ill to scramble for help. If you go to a hospital and they say, go home, you're not sick enough, that's not the hospital that you want treating you. Find a local doctor, find an urgent care center. Many of the urgent care centers offer better treatment than some of the hospitals. They'll provide the monoclonal antibodies, brand name Regeneron, and that's another key tool in the treatment in the early stages of COVID. You've heard about the medications, ivermectin, hydroxychloroquine, inhaled budesonide. Those are all excellent, along with Regeneron. But the key to all these treatments is you must be treated early. Don't wait until you feel like you're going to die and show up to the emergency department and hope that they can rescue you. Take your own health into your own hands and be prepared early before you need help. The other part of it that nobody ever talks about, or seemingly nobody ever does, is take care of yourself now when you're not sick. If you're overweight, lose some weight. If you're not fit, get fit. Make sure you're on some basic supplements. Have your vitamin D level measured and take vitamin D so you're in the upper levels of normal. There's a direct correlation between low vitamin D levels and bad outcome with COVID-19. If you go on my website, I list some of these supplements. RX4 Liberty, rx4liberty.com, and under supplements, I list these basic supplements: vitamin D, zinc, melatonin, quercetin with the letter Q, vitamin C. These are all basic immune support supplements that can help you. So if COVID comes knocking, like it is going to for many of us, your body will be in a better position to fight this off. Then hopefully you'll also get early intervention with some of these repurposed medications. The goal here is to keep you out of the emergency department, to keep you out of the hospital, and allow you to recover at home with these medications so it never escalates to a point where you need to be into the medical system and the hospital system.
I have to just ask, I appreciate that. What about getting the vaccine or wearing a mask? Should that be a part of the protocol you're talking about?
Listen, I'm not anti-vax, but what I am is I'm for personal choice, and I'm completely against mandates. No government agency, no private organization should be mandating anybody get a vaccine. You do your own research about the vaccines. What are the risks? What are the benefits? What are the potential side effects? And what is your own personal risk as it relates to COVID, and make a decision. You should not be coerced, forced, bullied into getting any kind of healthcare procedure. Masks, listen, it's not my opinion. There's studies over the years that show masks offer very little, if any, protection against a respiratory viral illness. So this nonsense that we should be masking the population, and in particular our children, is absolutely false. It's not based on science. And in my opinion, forcing a child to wear a mask at school is a form of child abuse, and you shouldn't do that. For me, pull your kid out of school if they're going to mandate that they wear a mask. It's unhealthy, it's unsafe, it interferes with learning, it causes anxiety, depression, suicidal ideation. We've seen the highest suicide rate in teenagers over this pandemic than we've ever seen before. We should not be masking our children in any way, shape, or form.
Amen. Well, Dr. Barke, thank you so much. I appreciate your time.
My pleasure.
As always, God bless you, and I hope you have an amazing Rosh Hashanah.
Thank you, Tim. Appreciate it.